Cervical cancer can be really hard to detect, especially in the early stages. That's why I've made this video today to go through the 7 essential signs that you should be aware of. What is cervical cancer? Cervical cancer is a type of cancer that starts in the cervix. The cervix is like a cylinder that connects the vagina with the uterus. Most cervical cancers start on the surface of the cervix, like here. You can also feel for the cervix. If you insert a finger inside your vagina, it feels kind of like the tip of your nose. So what are the symptoms that you should be aware of? I'll start with number 7 and break it down till we get to number 1. Number 7, persistent vaginal bleeding. Persistent or unexplained vaginal bleeding, which is outside of the pattern of your normal period or after you have sex, needs medical attention. Bleeding here could be a sign of cervical cancer, but it could also be related to other conditions like ectropions or in some cases infections. Unexplained vaginal discharge. Although vaginal discharge can vary from person to person and is a result of many different factors like your health or any conditions like BV or thrush, it's still worth getting medical attention. Unusual vaginal discharge, especially when it's blood-stained or smelly, without an obvious cause, will need medical attention. Although changes in your vaginal discharge can be common, especially during your period, if you notice there's blood in it, that is unusual and you should get medical attention. Pain during sex. Pain or discomfort during sex, especially pain that's not going away, will need a medical review from a doctor. This is because we'll want to check that the anatomy is normal or there's no other lumps or bumps which is causing the pain. Obviously, pain during sex can be due to a variety of factors, amongst which is cervical cancer. For example, there's other factors like not enough lubrication, which is probably more common. Postmenopausal bleeding. Postmenopausal bleeding is defined as vaginal bleeding after the menopause. This needs an urgent medical review. So for example, if you've completed the menopause and you notice you have vaginal bleeding, you need to speak to a doctor. This is regardless of whether or not you're on hormone replacement therapy. Whilst HRT can in some cases cause vaginal bleeding, we'll need to rule out other causes just to be sure about what's going on. Abnormal cervical appearance. Abnormal cervical appearance. If a doctor notices anything unusual when they're having a look at your cervix, that might be when they insert a IUD or routine part of taking a smear test. If we notice something that looks unusual, this could be a sign of cervical cancer. Often we'll need to send the cells off to the lab to be sure about what's going on. Unexplained weight loss or constant tiredness. These signs are usually much later on if you have cervical cancer. Weight loss can also be attributed to lots of different factors along with tiredness, so we'll usually have to rule out other conditions which are generally more common. Changes in urination. If you have a cervical cancer that's very large, it could put pressure on places like your bladder. This could lead to changes in your peeing pattern or more pain or discomfort during urination. My personal experience. I wanted to create this video as I noticed that many girls don't go for their cervical screening. This is a very quick test, and it can help you work out if you have cervical cancer early on when it's much more easy to treat. Additional tips to prevent cervical cancer is to make sure you've had the HPV vaccine, if it's safe for you to have it, and make sure you practice safe sex and you use condoms. The link between cervical cancer and HPV. Well, cervical cancer is primarily caused by the human papillomavirus. This virus is called HPV and there's many different strains. HPV is incredibly common and can lead to other conditions like genital warts. Whilst most HPV infections clear up on their own and don't cause lasting problems, in some cases it could lead to cervical cancer depending on the strain of HPV you've got. HPV, the virus, infects the cervix area, and usually the strains 16 and 18 are most associated with cervical cancer. These high-risk HPV strains cause changes on your cervix that may in some cases lead to pre-cancer and then eventually cancer, and that's why we do screening or pap smears to catch these cell changes early. As a doctor, I always feel quite concerned when someone says they've never attended for screening tests and they just didn't feel like it was important. I recently saw a 35-year-old girl who'd never gone for screening tests and was diagnosed with advanced cervical cancer. My advice would be to make sure you're attending your screening tests to make sure we pick up on these changes and treat you as early as possible. If I can ask for a favor, if you click the word subscribe, it really helps my channel to keep growing. Also, if you write a comment down below, I'll get back to you as soon as possible. Thank you for watching.